Hey there, this is the Public Health Podcast sorting through policy and wellness news to make some sense of what the single payer is going on in healthcare these days anyways. This is Healthy Schmelthy. That's right, folks. This is Healthy Schmelthy. And who am I, you may be asking yourself? Well, that's a fantastic question. Who am I? Well, I have a master's of public health. My entire career has been in healthcare. And guess what? My name is Rishi B, and I'm your host for this here little podcast. Healthy Schmelthy is a way for me to kind of help healthcare providers communicate healthcare to the public at large. You know, I think a lot of things get thrown around in the public, in the news and stuff about medicine this, single payer that, universal coverage, those. And a lot of people kind of scratch their heads and kind of wonder what that all means. And then they kind of turn to their pundits to help them figure out what that means. And I think sometimes it helps to have a voice of hopefully reason kind of takes a step back and explain what all that stuff means. In this episode, I'll be talking about Dafuq's Medicare For All. It's a great question, and I'm here to hopefully answer that for you. We'll be talking about single payer, universal coverage, and what are some of the healthcare reform proposals that are out there. And also, we'll be playing a snippet from a powerful speech that was made at the first ever government hearing on Medicare For All. We'll be capping that off with some positive news. That song there was Golden Light by the band STRFKR, otherwise known as Starfucker. They're an indie rock band from Portland, Oregon, and hope you enjoyed that song. I have a lot of fun with this band. They don't put out a whole lot of music, but when they do, it's pretty chill, and it always seems to hit me right at the right time. I saw them live once, and they were running around in astronaut outfits, and it was a lot of fun. Really enjoyed that show. And I think you'll enjoy their music, and you should try to see them live if you can. Check out more about STRFKR at strfkr.com. Hey, that was simple. Alright, so let's talk about Medicare For All. And I think in order to do that, I think first we need to all get on the same page. What exactly is Medicare? So Medicare is healthcare coverage through the federal government. Specifically, it's administered by a part of the government called CMS, which is the Centers for Medicare and Medicaid Services, run by a person named Seema Verma, who was selected by Trump himself. So this healthcare coverage is for people who are over 65 or equal to 65, or it's for people who are under 65 and either receive Social Security disability insurance or they have end-stage renal disease. And so there's a couple of different parts to Medicare, and the traditional one is Part A, which allows people who are covered to get hospital access. And then there's Parts B, C, and D, and probably everyone is aware of D. That's prescription drugs.
Because drugs are bad, okay? It's a bad thing to do drugs, so don't be bad by doing drugs, okay?
But B and C, they cover extra coverage like routine checks and stuff like that. And parts B and D, you pay extra for those. So the federal government will share the costs for Part A with you just right out of the box. But then the rest of that is kind of on you. But for all the stuff that you're getting through Medicare, for everything that you've selected to receive, Medicare is going to share your deductible, copay, and your coinsurance. But you have to pay premiums, which are a fixed amount that goes to the government, or sometimes it goes to a private insurance company that's doing that whole thing on behalf of the government. So then Medicare, just Medicare as we know it now, is coverage through the federal government. So then does that mean that Medicare for All is going to be single payer then? Everything is through the federal government? Well, that's a great question, but I think first we need to talk about what exactly is a payer. And you may have guessed it all by yourself. A payer is an organization that pays your medical bills. Go figure. But there's actually a couple of other things that they do. They enroll members. They provide members with a provider network. So that's that whole concept of in-network and out-of-network. And they're paying the providers and handling appeals and stuff like that. So there's actually quite a bit to being a payer in our current market right now. Some examples of those are HAP, United Healthcare. Just about every state has a Blue Cross Blue Shield. So what providers are doing now is they sign contracts with multiple different payers, and that's what defines what your network is. And that current system, how a contract gets established between a payer and a provider, is that a contract starts with a fee-for-service, meaning a contract is going to list a bunch of different services, and the payer will say how much they'll pay the provider for providing that service. So somewhere in the contract is a knee surgery. The provider says, I want to be paid for this when I do a knee surgery, and the payer's like, well, and then there's some negotiation there. So on top of the negotiation, there's also risk, which is calculated on top of the fee-for-service amount. So risk is kind of connected to these healthcare surveys that I'm sure everyone's done at some point if you have healthcare insurance coverage. And those surveys will say like, oh, are you a smoker? How much do you go to the gym? Things like that. And these payers and providers are actually using that information to calculate your risk. And so there's really no price control on that. So this kind of leads to the whole, these exorbitant bills that are being talked about a lot today. But what about Medicare? What about when the government is setting a price? When the government is setting the price, that's set by CMS, and there really is no negotiation for providers. So that amount is typically going to be less than what a private insurance company would pay a provider for providing that service. Meaning a doctor has a contract with Blue Cross Blue Shield that says, hey, this is what I get for providing a knee surgery. And then that same doctor, the amount that they're getting for a knee surgery through Medicare is probably going to be less. And so that's why I found this analysis through Kaiser Family Foundation. 93% of non-pediatric primary care physicians participate in Medicare, but of those 93%, 72% are accepting new Medicare patients. So what I'm getting at here is providers have more money to gain by contracting with multiple different private payers. Okay, so that's what a payer is. So then what's single payer? So a single payer is a single public entity is responsible for footing all the medical bills. So that could be just one government entity that's doing that, or actually it doesn't necessarily mean that. It could also be a combination of government plus private agencies. Our current mix that we have where the government and private insurance companies kind of share all health insurance members, that could be a way of doing single payer. But really, what single payer is there's only one healthcare insurance plan, and then individuals pick who their providers are. So there's a lot of ways to get single payer, one of them being Medicare for All. And then the other option is public option, which some of you may have heard. And that means that there's a number of different plans, and then one of them is a public option. And so there's some kind of word configuring that's been going on, because it turns out through some polling that 48% of America likes the word single payer healthcare, but 62% like Medicare for All. So that's why we've been seeing a lot of Medicare for All in the news lately. So it sounds like single payer covers everyone. So then, is that the same as universal coverage? Well, not necessarily. What's the definition of universal coverage? Universal coverage is everyone has affordable healthcare coverage. The key word being, and I'll let you guess what the key word there is, it's affordable. Good guess. Good job. Give yourself a pat on the back. So universal coverage has to be affordable, or else it's not really universal. So lower income folks have to be able to purchase that. And when we're talking about universal coverage and affordability, we start getting close to this concept of underinsurance, meaning people who have healthcare benefits, but those benefits don't adequately cover their medical expenses. And this has been an issue that's been increasing in America since 2003. So yeah, we have healthcare benefits, but we need to make sure that it's covering what we want it to cover. So universal coverage can mean a single payer system like Medicare for All, or it could be our mix of public and private payers in Medicare. Alright, so just to recap what we've been talking about, we talked about Medicare, what Medicare is. So currently that's a system where the federal government shares costs with you. And we also talked about what single payer coverage is. So single payer just means one agency is responsible for footing all medical bills. And we also talked about universal coverage. So universal coverage means everyone has access to affordable healthcare coverage. Okay, so now that we have those concepts down, now we can talk about Medicare for All. So what is Medicare for All? Medicare for All is just an outcome where we've established something called Medicare, and an agency is going to be setting payment rates to providers, and that same agency is going to share deductibles, copays, and coinsurance. So I say that in that kind of general vague way because right now Medicare is provided through the federal government. And so if we were to take what we have now for Medicare and provide that to everyone, that'd mean the government would be setting reimbursement rates for medical services, drugs, and equipment. But we could also change what Medicare means and then provide that for everyone. So it's important to remember that we could have Medicare for All, but that could mean our current system and then gradually bringing people within that system. So it's not necessarily Medicare for All equals single payer. So why are we talking about Medicare for All at all? Why M for All at all? A nice little rhyme for everyone. Well, you probably have heard of the news that healthcare spending has kind of gone through the roof. Right now, it's 18% of GDP, or $4 trillion as of 2017. And we're paying, as a nation, we're paying the most for our healthcare system. So you would think that the healthcare system would be really effective, but in comparison, it's not all that effective. For example, right now, our uninsured amount has dropped by almost 500,000 after Obamacare came out, but it's increased again to about 25 million people. Then also, 45% of uninsured people are saying that their cost of coverage is just too high for them to afford it. So those are some big barriers to the healthcare system, which kind of speaks to the system not really being all that effective and not being all that attainable. And that's important because people without healthcare insurance have worse access, and 20% of people without healthcare insurance forego medical care due to cost. And that's important to note because when those people finally go for expensive procedures and they can't pay for it, guess who's getting hit with that bill? So whatever we could do in advance to cover people without healthcare insurance and reducing that number would go a long way for everyone, not just for those people. Okay, so just to recap, we have a healthcare system that's just way too expensive. That's why everyone's been talking about single-payer healthcare, universal coverage, and Medicare For All is being proposed as a Band-Aid, as one of the Band-Aids. So, what are the Medicare For All proposals that are out there then? Everyone has probably heard about the one from Bernie Sanders, but there's also another proposal out there by Representative Jayapal, who's a Democrat from the state of Washington, and she's the co-chair of the Progressive Caucus. All those ladies in white that we saw on the TV from one of the State of the Union addresses. And she's actually a big proponent for Medicare for All, and because of her pushing and prodding on this topic, a lot of prodding going on in healthcare, she led to the first ever Medicare for All government hearing. Her plan is very generous. Cost-wise, there's a lot of questions about that. It is very bold, so it would be replacing both Medicare and Medicaid, what we currently know as Medicare and Medicaid, and it would bar employers from offering competing plans. The only other services that would still be active would be the Veterans Affairs and Indian Health Services. And it would gradually bring people into the system within 2 years. And it would basically cover everything, starting from hospital visits, going to elderly care, long-term care services. So that's a very generous plan than the other one being proposed, which is being proposed by our man Bernie Sanders. And you know what, folks? I'm sorry for this, but I can't talk about Bernie Sanders without feeling that sensation inside. Oh, you all know what I'm talking about. Come on, people. Feel the burn. Oh yeah, I am feeling that burn. Thank you, Bernie Sanders. I totally needed a good burn. So Bernie Sanders, he's totally blazed the trail for everything that we're hearing now about Medicare for All and other progressive ideals. But surprisingly enough, his plan isn't as generous as the one that we just talked about from Representative Jayapal. So his plan would virtually cover all medical services, except there's some exceptions with drugs that his plan wouldn't cover. There'd be some sharing there between individuals and Bernie Sanders' Medicare for All plan. And his kind of rolls in a little slower than Jayapal's. For Bernie Sanders' plan, that would have a 4-year phase-in that would start with older populations and then gradually let younger people in. And then I thought this was kind of interesting because not a lot of people are talking about what current healthcare employees would be doing. So Bernie Sanders' plan would have the federal government offer a job dislocation assistance for all the healthcare insurance workers. So you may be asking, so there's Medicare for All, but is no one else really bringing anything up? Well, no, there are lots of other plans actually. Senators from Michigan, Ohio, and Wisconsin proposed a plan called the Medicare at 50 Act, which would have Medicare be available for people over 50. So right there in the title, what a fantastic titling. I love a good title. Not so sure about this title. Senators from Colorado and New York proposed a plan they're calling the Medicare X choice. So that would make Medicare a public option for all. And then senators from Hawaii and New Mexico suggested also a public option plan, but instead of Medicare, they're saying, let's make Medicaid a public option to anyone. So that would allow every single state to control their Medicaid system. So the caveat with that would be the public option would vary from state to state. All right, guys. So we talked a lot about a lot of different heavy subjects and kind of lightly covered everything. But at the end of the day, what I want you all to take away from this is Medicare for All, single payer, and universal coverage are terms that get conflated a lot of the times. And that's because when we're talking about Medicare for All, we're usually talking about a single player system for providing that. But it doesn't necessarily have to be that. We could have our current system of both private and public payers and have something called Medicare for All through a public option. And the key thing with universal coverage, there may be some negative connotation with universal coverage, but all that's really saying is that there's an affordable healthcare option for everyone. And it would be great if this healthcare reform that's being debated would have bipartisan support. But all the plans that are being proposed are primarily from Democrats, and I want to say even entirely. I did some research to find something that's being proposed by a Republican, but wasn't able to find anything. However, I did see that there was a poll that was done by the news organization The Hill and also the Harris organization, and they polled conservatives throughout the country, and they found that 52% of conservatives support Medicare for All. And remember, what Medicare for All is defined as could be something completely different than what Mr. wants it to be. So all that info was great, but we never really talked about how much Medicare for All would cost. And that's a great question, a question that the Congressional Budget Office recently tackled. Congressional Budget Office, if you don't know, they get requested to do analyses, and where they seem to be coming in the news a lot for their analyses is doing predictive analytics on different healthcare proposals. Their statement about how much Medicare for All would cost is summed up by saying a single government-financed U.S. healthcare system would be complicated, challenging, and potentially disruptive. And in some ways, this report is really no surprise. It pretty much confirms what everyone already suspects about Medicare for All. The negatives being that the finances really are in question. They don't really put specific numbers, but they do point out that the federal government would be inheriting all what is currently $4 trillion of healthcare debt. And about half of that right now is being shared by the private insurance industry. The one positive, though, with Medicare for All is that there would be universal coverage, and there'd likely be a lot of quality improvements that come out from a single government-financed U.S. healthcare system. And why that would be is there'd be a lot of cost control as well, because administrative costs would basically be flattened out. which would be making preventative care more accessible. So some positives there, but also the finances, which are the big question, that's going to be a negative. I was listening to an assessment of Medicare for All recently. They were saying that single government-financed healthcare probably isn't going to happen anytime soon because those healthcare systems being such a large employer, that speaks volumes to a congressperson or a senator. But you know what? The government is doing some investigation into that. Just recently, Congressman John Yarmouth, a Democrat from Kentucky, he called a government hearing about Medicare for All, and he's expected to soon call a committee hearing on the concept of single-payer healthcare. But you know, this Medicare for All hearing was pretty powerful stuff, and there is a very impactful speech there. Let's take a listen.
The ugly truth is this. Healthcare is not treated as a human right in the United States of America. ALS now means paying out of pocket for almost 24-hour home care. This costs us $9,000 every month. The alternative is for me to go on Medicare and move into a nursing home, away from my wife and my son. So we are cobbling together the money from friends and family and supporters all over the country. But this is an absurd way to run a healthcare system. GoFundMe is a terrible substitute for smart congressional action.
So that speech there was done by a person named Addie Barkin, who was diagnosed with ALS about 3 years ago. ALS is also known as Lou Gehrig's disease, which is the same degenerative motor neuron disease that Stephen Hawking had. So he was speaking through, Addie Barkin there was speaking through a computerized voice to Congress at the first ever hearing for Medicare for All, and some pretty powerful stuff there. While Medicare for All may not be the answer that everyone's hoping for, there's definitely is opportunity for improvement. But Medicare for All has its opponents, has some pretty powerful opponents, and one of those is a lobbyist group that's being backed by providers and insurance companies. Once again, because a lot of those people are going to be put out of a job if Medicare for All or some other single-payer healthcare system gets put into place. And so there's a lobbyist group. They don't really have a name, but they did hire one of Hillary Clinton's 2016 campaign leaders to spearhead their effort to stop Medicare for All legislation getting too far. A little Tom and Jerry game there happening with Medicare for All. And their message, this lobbyist group, their message is pretty simple. The Affordable Care Act is working, so Republicans shouldn't be trying to repeal it. And you Democrats out there, you shouldn't be trying to replace it. Okay, so that's our talk about Medicare for All. Lots of different topics there, lots of different things that we talked about. Now, hopefully, some of that stuck with you. If you have any questions or any comments on anything that was talked about, please email me at therishibee@gmail.com. That's THERISHIBEE@gmail.com. And feel free to tweet me at RishiBH, or hey, just search for RishiBee. And you'll see my beautiful face smiling at you in a nice sunlit photo that was taken by a friend that I no longer really talk to anymore. Not sure why I'm telling you about that. All the music for today's episode was provided by the Portland, Oregon band Starfucker. That's STRFKR. Make sure you check them out at strfkr.com. And hey, listen to them. You can find them on Spotify, Amazon Music, YouTube, all that stuff. Make sure you give them a listen. They'll chill you out for the day. And you know what? Standing next to you, you're talking so loudly and you're all amped up all the time. You could use some chilling out, okay? And find show notes for this episode at rishib.com. I cobbled together this episode from a lot of different articles, a lot of different resources, and I provide all that at the show notes for every episode. So it sounds like we're heading out. You probably have heard these audio cues. That sounds like I'm summarizing, but before we go, I spoke to your doctor, and they said that you could use some good news.
Good news, everyone!
Smiley.
So that sound that you heard there was a gorilla laughing as a ranger was tickling him or her. This comes from some incredible videos and photos that were taken by rangers in the Virunga National Park in the Congo from Africa. And they went viral with some of these selfies that they took that showed gorillas in very amazing human-like poses. And that video that you heard, that was the gorilla being tickled. And man, when I was looking at that gorilla, it looks like just like a toddler being tickled. Or I shouldn't say a toddler, anyone being tickled and enjoying themselves. Any human. The video at the show notes for this episode at rishib.com. Make sure you take a look at that just to kind of get out of your day. If you could use some inspiring video or humorous video, make sure you check this out and, watch, share, and donate, These animals, they could use our help. We're at the top of the food chain, but that doesn't mean that we can't care about the rest of the members on that food chain. Well, hey, that's enough proselytizing from me. Oh, that's a big word. I'm going to ring my bell for using a big word. Thank you so much for listening. Make sure you check out rishib.com, subscribe to the podcast, email therishib@gmail.com, or find me on Twitter @rishibh, or check out the Facebook page for Healthy Schmelthy. Well, that's it for me. And, wash your hands. And you know what? You there listening to this, stay schmelthy.